Hey future nurses, ready to blow the lid off the NCLEX? Picture the exam not as a laundry list of questions, but as a secret puzzle where every piece is your ticket to RN success. Stay with me, because in the next 90 seconds you'll learn the insider blueprint to master the test. First, let's talk about the safe and effective care environment, which makes up 26 to 38% of the exam. A popular question here is, what is the best method for infection control? It's hand washing, scrubbing those hands for 40 to 60 seconds. Infection control and safety make up 1/2 of the content in the care environment. The other piece is managing the patient's care, collaboration, organization, and planning. Then, shift to health promotion and maintenance, about 6 to 12% of your exam. We're talking disease prevention and early detection. So, a pregnant patient with a blood pressure of 150/95 and protein in her urine is showing early signs of what, with these otherwise nondescript symptoms? Did you guess preeclampsia? High BP, proteinuria in pregnancy. Recognizing these clues can save lives, both mom and baby. Next domain is psychosocial integrity, also 6 to 12% of the exam. This domain tests your ability to support patients' mental and emotional well-being. Therapeutic communication is an important skill. Remember to skip close-ended yes or no questions. Instead, ask open-ended ones like, "How are you feeling today?" or "Tell me more about what's going on." This builds trust and encourages dialogue. Finally, physiological integrity dominates at 38 to 62%. This heavyweight section covers everything from basic care and comfort to pharmacological therapies, risk reduction, and helping patients adapt post-illness or surgery. For instance, no normal potassium levels range are 3.5 to 5.1 milliequivalents, and deviation can be life-threatening. Also covered here are topics like using anticoagulants, such as heparin, for DVT prophylaxis. Learn the blueprint and use it to study. Check out additional details on the NCSBN website, ncsbn.org. The link is in the description. If you're ready to dominate the exam and unlock your RN future, hit that subscribe button now. Remember, if you have the key, yes, you can crack the NCLEX code.